Okay, formal good evening to everybody. Today we'll have a approach to history station. We'll have a small approach to history station, and we'll see across this approach two history stations. We'll discuss those history stations, and we'll see how to approach these GIT stations through the model. Okay, so we'll have some kind of cheat where how can we uh, have an history session in a proper defined way. So each of the MRCPCH stations has certain agendas. The Royal College has fixed certain domains where we are assessed. So similarly, in a history station, we'll have certain domains where we'll be assessed. So in this class also, we'll discuss in such a way that we are being assessed in that. So I request everybody to keep your connections mute so that will not disturb others. Okay, we'll start. Mutasa, you are ready? You know the timings?
Yes, sir. It is 4 minutes of like I will be given outside.
4 minutes
Then,
outside.
with the history, what I have to take, what my task. Then 9 minutes plus 4 minutes for history taking.
Inside.
Then inside 9 plus 4, 13 minutes, and then another 9 minutes for discussion with the examiner.
Yeah, good. We'll start. I'll just display and start the time. This is your station. You'll have 4 minutes now.
You're not sorry for us. Yes, I am.
4 minutes over, you enter the exam hall.
Hello, good evening.
Good evening.
This is Dr. Murtaza Kamal, one of the baby doctors in hospital today.
Hi,
Am
doctor.
I talking to Mona's mother?
Yeah, you can call me Lena, doctor.
Hi, Miss Lina. How are you doing?
I'm doing good, doctor.
So, Mrs. Lina, I am here to discuss about Mona today, and I will be asking you a few questions.
Yes,
And
doctor.
while you, yeah, that will be nice. And while you are answering, may I jot down a few important points?
Sure, doctor.
Thank you. Thank you. So, Mrs. Lina, what is your main concern about Mona?
Doctor, you would have read the GP's letter.
Hmm.
This girl, she has been doing this accidents from 2 years. When she was 2 years, she started doing this. Initially, we thought that she's a very small kid. She has to be trained. And now more and more her accidents are more, doctor. And
Mhm.
we are just fed up with her accidents. This happens every day in the school, and it is affecting her school, and it is affecting her behavior. So we are all very tired and exhausted. The GPs gave a lot of medicines, doctor. That's not working.
It must be quite concerning for you
Yes,
and
doctor.
family. I understand your points. So, like, can I ask you a few more questions? Like, how, like, the problem started from the age of 2, as I could
Yes, doctor.
understand,
Yes,
and
doctor.
how frequently does she open her bowels? Like once in a day or in a week? How many times?
Usually, she's doing it maybe 4 to 5 days once. But she passes sometimes in a knickers, doctor.
Mhm. Yeah. So you mean to say that the stools are like very hard and she frequently passes in once in 4 or 5 days. So do,
Yes, doctor. That
right.
is always there, doctor. Whenever she passes at home, it is very, very hard, and it
Mhm.
comes like a solid rock.
Right, I
But
understand. It sounds
almost daily, she passes something in the knickers. That's a little bit soft, but it's always there in the knickers.
right. Okay. So is it painful? Does she complain of pain sometimes while passing stools?
Very much, doctor. She never
Mhm.
sits. She always stands. She leans
Right.
to the wall. Once she starts doing that, we know that she's finding it very difficult.
Right, I understand the concern. Have you ever noticed blood in the stools, like in her panties or in the stools?
Many times, doctor. Many times. It's almost always.
Hmm. So, any certain circumstances which are there, like does show more in the summer seasons or any diet change when it happens, or is it like it doesn't have any effect on it?
Nothing like that, doctor. It is almost always like that. It's always the same.
Hmm. How difficult was it for to potty train her in the initial parts of her days?
She always had that difficulty, doctor. We as a family found it very, very difficult. She has a younger sibling, and that boy is already trained, doctor. He is only two and a half. He is already trained. But this
Mhm.
girl, she found it very difficult. And still, we couldn't figure it out why it all happened.
Has she been a fussy eater?
No, doctor, never. But because this is there, she usually doesn't feel like eating.
I understand. So, what is like? Can I ask, like, is she prefers taking more of fibers in her diet? Like, what is the fiber content? Like more of vegetables, fruits. Does she eat those?
Her food habit is like this, doctor. Morning she eats some breads and then some potatoes. Then she drinks a lot of juices. She drinks watermelon juice. And then afternoon she takes sometimes some vegetables, but many times she doesn't like vegetables. She eats a lot of pizzas, and she prefers a lot of cakes.
I do understand. So basically, her appetite, it seems to be normal. Is it normal
Yes,
according to you?
doctor. Yes. Can you all please mute yourself? You're spoiling others' session.
Uh, do you think that she's allergic to some foods or certain medicines, something like that? Any allergy?
No, doctor. It is not some. There is no apart from this. Whatever the GP has given, she is not taking anything. Uh,
Mm-hmm.
but I feel if she sometimes she drinks a lot of milk. Some days she goes without food and she drinks a lot of milk. Whenever she does that, and she has more constipated. She feels more. Uh, her stools are more harder.
I got the point. Does she complain after this abdominal pain or bloating sensation, something like this?
No,
When
doctor.
she takes lots of nothing like that.
No, doctor.
Okay. Any history of fever?
No, doctor.
Never, like nothing. And how is her sleeping pattern and like that? Is she able to sleep well?
She does, doctor. Once in a while, she cries of tummy pain in the sleep.
Mm-hmm.
But otherwise, there is no much difficulty in sleeping.
Okay. And does she have any like swelling in the neck, something like she feels fatigue, swelling in the neck? Overall activity, how is her overall activity?
Oral activity is good, doctor. She just feels little uncomfortable if the accidents happen. Otherwise, she's well, doctor. She doesn't have any swelling or anything like that.
Right. And how is her like? How does she pee? Like any peeing issues, anything, bedwettings, anything?
Doctor, no. Once when she was around 4, she had a urinary tract infection. That is what the doctor said. She
Mhm.
was given some medications, and after that, she became well.
Okay. Okay. Any lumps or bumps in the body, if you have observed ever?
Nothing like that, doctor.
Anything, is she able to, like sometimes she complains of her able to hear her heartbeat, something like this?
No, doctor, not like that.
Okay. So no history of any coughs, respiratory infections, repeated, nothing like that.
No, doctor.
Any rash, joint pain, she complains of anything you have observed in the body?
No, doctor. No, doctor.
Okay. So has she, with regards to her past medical history, she has had this complaint since last 2 years. Had she been ever admitted anything in hospital anytime or any other complaints or similar complaint?
No, doctor. She was never admitted.
She must be consulting like GP for it. Any investigations have been done for it?
Uh, he did some bloods, doctor, but he said everything came normal.
Mhm. Okay, okay. And the GP has prescribed some medicines which are like not working much according
Yes,
to what it could be.
yes, absolutely.
Any travel history of like significant travel to another country or anything?
No, doctor.
So how do you describe her? Like, how was her birth like? How do you describe your pregnancy? Was it like okay according to you? All the scans were fine. Anything important which you like to tell me?
Um, One time she was normal, doctor. She was a normal delivery.
Mhm.
She was weighing 7 pounds like that, and
Right,
she was roomed in immediately. All the checks were normal that time. 9 minutes over.
right, right. Did she pass stool in her initial 24 hours of life, or she passed after that?
Yeah, she passed stools. That was a black stool, they say, and she did that earlier.
Okay, in the initial 24 hours. Right. That's
Yes.
great. Was a heel prick test done for her at the time of birth?
Yes, doctor. They did some tests and all the tests turned out to be normal.
Great, great, that's great. Her jabs have been completed.
Yeah, her jabs have been completed, doctor.
And how is her school performance? Is she coping up with her like peers' school performance and all?
That is what is taking a hit, doctor, here. Um,
Mm-hmm.
Nobody sits with her in the bench, and they say she's always smelly because of this, and she has to be cleaned almost every day by the school nurse, and they we have to send an extra dress always,
Mm-hmm.
and this affects her, and they started teasing her a lot, doctor. They say, Mona, Mona, the girl with the, what is it, poop. They just talk like that, poop Mona, like that.
I understand. Must be quite distressing for her. And how does it affect like the family members, like you all?
It's quite
Yes,
disturbing, doctor. We are
yes.
always worried when this accident is going to happen. So it happens almost every day, doctor. Yeah.
Mm-hmm.
Um, Her father is also a little upset because of this. He is asking why this problem is not going away.
Mm-hmm.
Will it be a lifelong problem? Why it is not solved even after bloods?
Right, right. We will be working on this. I understand. And like it must be like quite like financial strain on the family also. So how is it going? Like, are you able to cope up with these things the child is having at school, like teasing, and she
Not
must be
much,
having
doctor. All
absenteeism
those
in
things
school.
are covered by the
So
NHS.
how are the like you people are coping with it, like with regards to financial aspects also? I'm asking.
Not much, doctor. Almost it is covered by the NHS. Everything is covered by the NHS.
Hello, hello. Am I audible?
Can, can you hear me?
Yeah, I can hear you, sir. Yeah. So how are the family members like? And like you both are husband wife are there, right? And
Yes,
Mona is there. And other family members, how are they?
they are all good, doctor. We have one younger kid, and we four are allowed in the house, and
Mhm.
all of us are doing well.
No history of constipation in the family
No,
or
doctor.
anything similar complaints.
Nobody else. Not in the remote memory of mine.
Hmm. Right. So and are like is your husband and you are blood related?
No, doctor. Not blood related.
Okay. So I and any other like who all are involved in the care of the child? Like is there any school nurse who is supporting the child or
Thanks.
community nurse?
You can
So
finish. Yeah,
who all are
we have been getting support from the school nurse, the school teacher. They are all very supportive, doctor. And they have attached us to the constipation support groups in the
Mhm.
locality, and I'm trying to figure it out by talking with the other moms.
Okay, thanks a lot for sharing the information with me. So I'll be summarizing it.
Yeah, please.
Today, today I had the opportunity to take the history from Mrs. Lena, mother of 7 years old pretty girl Mona. Mona has a complaints of like infrequent passage of stools since the age of two when she was two, and she is known to soil her knickers on and off, because of which she is having like quite issues at school, which is she is being teased by the school members, and the family is also distressed about it. She had a history like her dietary intake is mainly under. She also complains of abdominal pain, which is mainly after taking uh, milk, uh, basically, and she her she has passed the stool in the initial 24 hours of life, which is an important history for me.
Okay, you finished your summary?
Yeah.
Okay. Tell me, doctor, what do you think will be the cause here?
So, as with the history which we have got, this is like a case of chronic constipation,
Okay,
which with overflow incontinence, which she is doing.
okay,
The putting the causes of constipation uh, with history, I could make a cause of like functional constipation as my first differential.
okay,
Other differentials which I will put is like endocrinal disorders like hypothyroidism
okay,
or hypercalcemia
okay,
will be other. Rare possibilities will be like anorectal malformations
okay,
or cystic fibrosis
okay,
or neurological causes like spina bifida.
okay. So how are you going to proceed with the management? How are going to approach this?
So first of all, for the management purpose, I will involve my senior in this.
Okay, good.
Right. So I will involve my senior in this case. I would like to plot her height and weight in the appropriate charts. And
Okay,
then I would like to do a thorough examination, formal examination of the child
okay,
for this case, followed by investigations. For like, I would like to do in examination, I would like to emphasize on the neurological status of the lower limbs. I will see if any dimple is there in the back, anything. I would like to do a abdominal examination to see if any scars are there, thinking of like Hirschsprung disease and mainly this. And then I will proceed on to the investigations.
what all investigations you want to do?
So the investigations will be like supportive investigations
Okay.
and like diagnostic investigations.
Hmm.
So in this case, I would like to first do the investigations like a thyroid function test, if he is hypothyroidism or not. I
Okay,
like to see her calcium levels, if there some hypercalcemia, potassium levels, any hypokalemia is there. Then second line investigations, I would like to go ahead with testing for celiac disease, her IgA levels and anti-TTG levels along with it, and then proceed accordingly if the things are there. And I would like to see like if I am a remote possibility which I have kept is like Hirschsprung disease. If I get an examination and findings like abdominal scar and all, then I can go ahead with rectal biopsy in my uh, plan.
if these are all not working, you'll plan a rectal biopsy.
Right, but I'm not getting anything specific for Hirschsprung. Like there is no delayed passage of stools,
Okay,
and constipation is not present since birth. It started 2 years after birth. So these are the points which are not in favor of Hirschsprung disease. So I'm
okay,
keeping it in the down list.
okay, good. So what are you going to advise to the mother?
Mhm. For this, like advice to the mother, I would just like to
Hmm.
do first like lifestyle modifications of the child. I'll try to educate the parents and the child about lifestyle modification, the importance of fibers in the food. I will
Okay.
tell that the fibers content in the food is to be increased. More
Hmm.
of fluids are to be taken, and like activity should be increased. She should have an active lifestyle in that, in which I will educate both of them.
Okay.
Then some like behavioral changes could be uh, like some psychological help we will give, we'll attach them to some uh, school nurse and community nurse will be involved in that,
Okay.
and we will give them like something like marking them with stars if they passes stools at a particular like after a particular period of time,
Okay.
and like after having evening meals she has to compulsorily sit in the pot, and even if she is not like feeling to poo, she will be made to sit so that habit develops and she can be given stars on that.
But
And
she's not
then
able to sit. She's crying. Mom is worried that she's not able to sit. She's always standing. What could be the reason? How you can explain that to the mom?
So it can be due to like the constipation which is there, which she is having. So for that, we can give some disinfectant medicines to the child, like Movicol or stimulant laxatives like Sena.
Okay.
And if these don't work, then we can give like osmotic laxatives like lactulose also to the child.
Okay.
If like oral medications are not working, we can go ahead with rectal enemas, or even manual evacuation under anesthesia can be tried in those cases if it is like very hard and we are unable to get anything in like orally.
Okay. So any other specific change in the lifestyles you want to do?
So her toilet training again is to be like properly done in the form that she has to go to the toilet for particular times, like it should be fixed, and she should be encouraged for that in the form of stars and all.
Okay.
Fluids to be increased, food which I have already mentioned. I think this is only for lifestyle changes.
Okay. So suppose if this is there in other kids, the younger one also, what do you think will be the cause?
So if it is in the other kids, the causes can be like it can be other diseases, like even celiac disease is a possibility in that case.
Okay.
And in those cases, then we will have to go ahead with the like other history, supportive history, like other autoimmune changes. Any diabetes mellitus in the family is there or not? Any
Okay.
hypothyroidism is there? Those autoimmune changes we have to see in the family members also, and then we can proceed ahead with the like investigations for it. Anti-TTG, TTG, IgA levels, then endomycin antibodies accordingly.
Okay. Okay. Your time's up. Well done, Murtaza. You made a very good attempt. I think mm, you're almost completed everything. Okay, let's see. Let's hear from others. Anybody who wants to add any other points you feel Murtaza has not done that?
We didn't ask about anthropometry, I think, like
Uh,
how is her growth?
Good. He didn't ask much about the growth and the development. Good. Any other points?
He also has to ask about like a holding behavior of the child,
Yeah,
like
he didn't go much into the details about the uh, how the child is pottying. At what time, where the child is sitting or standing, who is accompanying, what is the position. So all this he didn't ask much about it, but that's okay. He did ask some. He did touch upon that. How many times, all those things he asked. How many times per day, or how many days once, all those things he asked. Okay, good. Anything else? Anybody can add? How was the time management? Can anybody tell that? How was the time management? Do you think he finished everything, all the parts in the history? Well, what Murtaza? You almost did everything, but as she said, you didn't touch some of the things.
I tried to complete all the stems, but inside the stems, I could not complete many things.
Complete many things. Good. Okay, so let me tell you, there were some few things only I have written. Respiratory infections, then a rash and joint pain. Might be rash, they may accept joint pain. Respiratory infections you can avoid. You can ask cough, cold with fever like that. Why did you ask about travel history? Any specific reason?
In constipation, nothing specific. In diarrhea, it's important.
Yeah, in diarrhea it's important. In constipation, I think that
It's
sometimes the reason travel they take more junk and they end up with acute constipation. So you can ask that easily if you are thinking in terms of acute constipation.
okay.
Then you said about overflow incontinence. What is the idea about overflow incontinence here?
Overflow incontinence actually, it's not classically overflow incontinence. It is used in the term of bladder
Okay.
basically.
Okay.
This is like any swelling which occurs.
Yeah, you can use the word fecal soiling. That is a better terminology. So what is the difference between fecal soiling, encoparesis, and overflow incontinence in your constipation? What is the difference between these three?
Encoparesis basically is the passage of normal stools in inappropriate situations.
Yes.
Basically,
What is fecal soiling then?
swelling is basically, it is like in a constipated child. This is not a normal like passage. The stool is getting impacted, and then due to the distension in the rectum, it's being passed in, uh, it's being passed and soiled.
Yeah, it kind of little loose stools which escape the bigger constipated stools and come out. So that is fecal soiling. So that's what the child has. More of incontinence, more than incontinence. Incontinence is something which happens in a child who has a poor anal tone. So you can say incontinence if the child has a poor anal tone. You can say soiling is a better term, and encoparesis if the child is formed stools. But I think you didn't explore in that aspect. Is it only constipation or constipation with the encoparesis, or is it a constipation and an overflow of fecal soiling? Okay. So, did you ask about the impaction? What is impaction here?
Impaction basically is it's the hard stool. If when we do like rectally manually remove it, then it will be coming out like in a gush, something like that. Not very sure.
The impaction is a tool which is very difficult to remove with the medical management or may need sometimes surgical management. So you never asked about whether they had any other much more treatment, but she clearly said apart from this we are not giving anything. So that is okay. And sometimes you talked in between when the mother was talking, so that also the examiner may not like. So maybe I think you had some connection issues. That is the reason you were talking in between the mother, but that is okay. Bloods needs to be checked, and I already told you that most of the blood tests were checked. And advice to the mother, I wanted you to emphasize on juices, pizza, bread, and potatoes. So you avoid all these because she was on only these drugs. So you try to avoid all these, and then you try to give emphasis on more fiber. And treatment management. How come? How better you could have said the treatment?
So for treatment management, I could have divided into non-pharmacological and pharmacological. Like
Yes.
in non-pharmacological, the advice to the mother, the lifestyle changes that we just told,
Okay.
and then like support of community nurse and school nurse,
You okay?
along with regular toilet habits, and like psychological supports.
Okay. And addressing the bullying, liaison with
Yes,
the school.
right.
So all these things we did. And more importantly here, which is most important is giving them a disinfection dose here. So she has tried uh,
Mhm.
lactulose and senna. So lactulose and senna is mainly for maintenance therapy. Okay. So we want a disinfection. So what we will give for disinfection?
Movicol will work, sir. Peg.
Yeah.
Ethylene glycol.
Movie call, how much you give?
movie call is
Yes, Dr. Ramya, you can tell. You can unmute and tell.
Sir, is it 2 ml per kg?
It usually you tell the dose in grams.
Gram per kg.
Grams means,
0.5
sir,
gram per kg.
yeah. If it is grams, sir, usually we take as 1 gram per kg.
Point-
0.5 grams per kg is usually the maintenance dose. So you give a stiff dose for disinfection. You give at least 1.5 grams per kg per day. But if you see the guidelines, they give it in incremented dose based on the age and based on the weight for 7 days. So you can tell in that. I think it is very difficult to tell the number of spoons as per the guidelines. But you can clearly say that it can be 1.5 grams per kg per day. So that will be a better answer for disinfection dose. And then you can give 0.5 grams per kg per day as a maintenance dose. So how many days you want to treat Murtaza? For how many days you want to treat?
so for the initial 1 week will be the disinfection, and then I'll go for 6 months maintenance.
Yeah. So you have to tell the mother that this is going to be a long-standing problem, needs a long-standing course. So they should not stop. So you didn't explore those things. How many days they took the drugs? So that was there in the STEM actually. That was an hidden agenda. Because this mother was doing something. She, as soon as the child passed normal stools, she stopped the drugs.
Okay.
That was one thing which you need to explore in constipation. So how many days and how many days has been advised and how many days they were taking. So that is another important point. Okay, so good. All the more it was a very good attempt. So what did you do? How are you going to approach a history station? So how you spent your time outside? You are waiting for 4 minutes. So how did you spend?
So like 4 minutes, like there is approach of 3-column charts which you make, 4-column rather.
Okay.
So in the initial 6 minutes, I'll be taking like the history of presenting complaints,
Good.
mainly the main concerns.
Good.
Different mnemonics are there in which we have to take the like onset, the time, duration, aggravating factor, relieving factor, how the things are going.
Okay.
And then we have to finish the system examination in this 6 minutes ideally. Like
Okay.
other systems should be streamed.
So how do you spend time outside those 4 minutes waiting?
So first of all, I'll write the name of the child and the mother in block letters big so that I don't miss it.
Excellent. And more importantly, you don't read this entire STEM. So all this information given to candidates, you are requested to take focus history, this 13 minutes, all this you know by heart. So you just don't spend time reading this. And as you said, write in a big letter, what is the name of the child and what is the name of the mother. Excellent. Then
I'll be like writing some of the like initials so that dividing my time so that I can have those points to jot down.
Okay.
In vertical columns. As first column will be like in which 6 minutes I would like to give approximately.
Yeah.
To present the history, main concerns, what the mother has. I'll try to explore it in all the forms, like onset, duration, what is like the intensity, any aggravating, relieving factors for the things, and try to finish the system examination with 1 or 2 questions maximum in each system, which is like relevant for that particular history.
That means basically you'll put a proforma on one side, but did you make an attempt to put the etiology and the red flags on the other side?
No, I didn't.
Okay. So what do you think will be the most important red flags here?
So the most important red flags in this is like first is this one, her soiling of her undergarments.
Okay. So do you think that is a red flag?
Not really.
Somebody said you did explore on growth and development. So what will be the flags?
Like failure to thrive if it is there.
Yeah, constipation and well-thriving child, it's fine. constipation and failure to thrive is not a good combination. So that is one point. Then
Passage of stool beyond 24 hours of birth will be a red flag if it was there.
good, that is another red flag. Then
Abdominal pain with constipation.
abdominal pain usually happens.
Okay.
Anybody else? Any other red flags you want to add?
Any vomiting.
Vomiting is a good red flag sign.
Yes,
Vomiting with
vomiting.
constipation.
Any family history of irritable bowel syndrome or inflammatory, like celiac
So,
disease.
yeah, that is the etiology. So we want to know what is the red flags here.
Abdominal distension,
Yeah, abdomen distension is one red flag. Then
urine retention,
Vomiting.
vomiting, she already said. Urinary retention
urine.
or associated urinary symptoms means this your bowel is pressing the bladder and or urine is staying back. There is a post-void residue.
Neurological manifestation, lower limb weakness and tiptoeing and stiffness of yeah.
Very, very good. Abnormal
If
neurological.
there is, yes, if there is tuft of hair on the spinal cord or lipoma,
Yeah,
atypical dimple,
very
yeah.
good. Then anything else?
Recurrent respiratory tract infection.
Okay, so that will come with failure to thrive. Okay. If there is
Blood and
early
stools.
onset constipation or if it is an acute constipation, bleeding per rectum, he asked. So these are some of the red flags. Any other red flags you want to know? Something which will present like this abnormally in some kids as constipation.
Any eating
it-
disorder?
Any?
Eating disorders.
No, not likely in this age.
Any
But-
causes or concerns of abuse?
Very good. So any abuse. So any sexual abuse, physical abuse, there will be an acute constipation. And you should ask about the status of the child. So these are some of the red flags that you should need to write it down. So as Murtaza said, you put your pro forma and then you put your etiology and the red flags outside. So keep all these in mind so that you can tick and ask questions. So he said, I will spend 6 minutes here and 3 minutes there and 4 minutes. So Murtaza, by the time you finish your treatment history, it was almost 9 minutes. So that is where you asked the birth history faster and diet history. I told you, I gave you the whole diet history. So you asked about the jabs. So you didn't touch about growth and development. Family and social, you asked. Sleep asked, and the illness coping also you asked. School, you can be a little bit more elaborate because there was bullying in the school, so you can give more time to the school. So you had all the empathy, everything in your presentation. But in which all scenarios you'll give how many minutes? Is it going to be the same in all the scenarios? Murtaza, what is your idea?
No, it won't be same actually in all the scenarios.
Okay.
But, in scenarios like social issues, very important in these cases, like the case which we have just discussed. So the impact on the child and the impact on the family, the social issues. So we might have to give a bit more time on this.
Yeah, you try to finish everything by 9 minutes, and by the time the bell rings, you should be alert with all the social issues, and you can finish with the illness coping. Good. See, but do you think if a child has a headache, you are given a history of headache, do you think you can give this allotment? Anybody? What is the difference in a child with a headache history and a chronic history like constipation?
Acute headache.
Yeah, acute headache. Acute headache.
Like we need to more focus on our developmental histories. Any developmental delay or anything.
No.
The
See,
present history of present illness needs more time in case of
yes, that's very good. So, in an acute history, it may not be this 6 + 3 minutes, but it can be even 9 minutes for the presenting history, systemic screening, complications, and treatment. So then you will have less time for your family, social. So you can just rush through this birth and diet and growth and development and immunization. So you can just ask, did you have any problems during the born time? No, doctor. How was his eating habits? It's all good, doctor. So was she all before this episode? Was she growing well? Yeah, she was growing well. She has been following her sentinels in the red book. How was her development? She was catching up the milestones. Yes, she was catching up the milestones. And these are jabs all done. Yes, so that will take only 1 minute, and then you can run to the family and social and school and heads. So if it is going to be an acute history, you concentrate more on presenting history. So what is the difference between the history in acute and in chronic? Murtaza started with the open statement. Do you all agree? So in acute history, you don't start with the open statement. You better ask them yes or no. Did he have trauma? If it is a headache, did he have trauma? Did he have any loss of vision? Did he have any hearing problems? So is he having any fever, or is he having any vomiting? So you keep asking those questions faster with yes or no, so that you don't ask an open-ended question. So that will take you away in an acute history. So if it is, how do you spend your time in each is based on whether the history is acute, if it is acute or chronic, or a chronic history. So here he had a chronic history. That is very easy. You catch this stem, 6 minutes plus 3 minutes plus 4 minutes. If it is going to be an acute history, as she said, you give more minutes, 9 minutes to the presenting history and the system screening with complications and treatment. And it will be a little tricky if you have an acute on chronic history. So you have to be little careful if it is going to be a acute on chronic history. If you get whatever points you get easily faster, then you finish it in 6 minutes, or give another 1 or 2 minutes if it is going to be a acute or chronic, because any acute illness, you need to have a detailed system screening. So you must have a detailed system screening. Here, his system screening was little small, that I can understand, because he had a chronic history. He knows the condition. He knows the etiology. So that's why his system screening was small, and the examiner will be okay with that. But if it is going to be an acute history, give a detailed system screening. Then comes your puberty or non-puberty. What is the puberty age for girls and boys?
8 years for girls
And
10 for boys.
9 years
10
for
to
boys. Okay. So you can say that's okay, but see if it is a puberty age or a non-puberty age. If it is going to be a puberty age, you need to bring your
It is.
Tanner staging also.
Yeah, you need to bring your Tanner staging, you need to bring your heads. So if it is going to be a puberty, when you are sitting outside, the age is pubertal age, then you try to cut short your birth history. You try to be in finishing those things in one line, your growth and development, and then give more history to heads. These are all some clues, but you may need to modify it. But these three things will give you some time management. So what if it is going to be a less than 2 years and more than 2 years treatment? So there is
Less than 2 years, more on development we have. Development we have.
Yes, so less than 2 years and less than 2 years kids, these 3 minutes you may need to expand the middle stem or the middle column, you need to expand a little bit more. So you need to concentrate more on diet. You need to concentrate how they prepared milk, how they are feeding, how is the growth and development, how is the immunizations, jabs that has been done. So you concentrate on this middle column more, and there's obviously there is no heads here. So you can cut short of the other things there. And if it is going to be a more than 2 years and less than, it's always easy if you get a child like this who is 7 years, between 2 to 8, and if it is going to be a chronic problem, then this is a straightforward history case. But if it's going to be a less than 2 years or a pubertal age with an acute or with an acute on chronic problem, then you need to be little more alert. So I think this will help you. So how are you assessed? So these are the 5 domains that you will be assessed. You will not be assessed only with your identification of the problems. So you have 2 marks for information gathering and the history taking. So the history taking, entire history taking here will give you only 2 marks. So based on that history taking only, you need to do the management planning and clinical reasoning. That is another part. But the entire history taking will give you 2 marks plus your verbal and listening and communication skills during the history taking. So you need not interfere the mother. Here also you give 60% to the mother and take 40% for you. So you give more time to the mother. So there your rapport, your communication skill, your showing of the empathy. So all this will count here. So only history taking part gives you only 2 marks. So here also you should have a good communication skill. You should listen to the mother, and you should give more. You should add empathy. Oh, I'm so sorry. It must have been very difficult for you as a family. So all these things he did very well. So you give these areas some attention. Then your summarization. Put everything in a nutshell. Try to summarize your part in 1.5 minute, and then give your management planning. So your 9 minutes of discussion with the 2 minutes of summarization and 7 minutes of management planning carries 2 + 2, 4 marks only. So you divide your attention to all this so that you will get all the 10 marks that you are eligible for in the station. So how will you tell the treatment? Murtaza said he had a little bit difficulty in the treatment. So I have some small cheat code for you. So you can use this for any treatment model, any history station. So you start like this. You keep this in the mind. You start like this, sir. I will involve a multidisciplinary team. I will just go through all the records that the GP has sent, and then I will involve our gastroenterologist, and then I will involve our consultant, and then I will involve our constipation nurse, and then I will go for the specific treatment in the form of a proper disinfection dose, and then I will give a maintenance dose. I will ask the mother to adhere to the maintenance dose for at least 6 months. I will also involve the social worker since the family is very upset. I will do some modifications in the school by doing a proper liaison with the school nurse. And then I will ask them to follow up every week or every 2 weeks once. Initially for constipation, you should at least follow them every week. You should ask them how the stool, what is the chart that we are going to give them?
Bristol's.
Yeah, you have to give them a Bristol stool chart. So you can Google it up and see what is a Bristol stool chart. I will see I will give them the Bristol stool chart, and I will ask them how the child is going to pass the stool through the Bristol stool chart. And then I will tell them all the warning signs. And here there is no proper, there is no need for any genetic counseling. But if that is going to be a cystic fibrosis case, then you may need a genetic counseling. And here there is no need for bracelet, but I'll ask them to maintain a diary. I'll ask them how, what all food substance that is causing and what they are giving for the child to eat. So these things I'll ask them to maintain. So like that, you can use this for any scenarios. And if it is going to be an acute scenario, for example, if it is going to be a meningococcemia, so you will admit, I will isolate, and then I will notify. Whom all you will notify? Can anybody answer? Whom all you will notify? So you will notify the government, then you will notify your hospital, you will notify your ENT people, or if it is going to be, yeah, it's going to be a public health department, then you will notify the public health department. Then you will inform the PACO, you will notify the PACO that such a case has come to the ER. So you will notify if there is a strider case, you will notify your ENT, you will notify your anesthetist. So you will give a notification, and I will do a proper examination with the personal protection. So if it is going to be an acute case, you start like this. If it is going to be a chronic case, you start like this. So you'll properly utilize, you'll bring everybody inside. If it is going to be a cerebral palsy child, you'll do the occupational home modifications. All these things you can bring. Okay. So I want you to structure when you are going to spend 4 minutes outside, write the etiology, write down all the red flags, and then structure your history. See if it is acute or chronic, or acute on chronic. See if it's a pivotal child or a non-pivotal child. See if it is a less than 2 years or a more than 2 years. And then based on this, you give allotment to your history time. Okay. So are you ready for the next? We'll have one fast history. Who is taking?
Uh,
Shrikant.
yes, sir. I'm
Yeah.
interested. Yes, sir. I want to.
Yeah. Okay. Shrikant is ready. Good. Okay. Let me. You try to stick on to this plan, Shrikant. The others, you please write your, as soon as you display, you please try to write down the etiology, and then write down the red flags in your paper, so that you write down your scheme of things and how you are going to approach here in the 4 minutes. Try it down in 4 minutes. Others, when he takes the history, you write down the points. I can ask anybody to summarize also. If you are interested, you can give a summary and try to summarize in 1.5 minutes. You put it in a single line in 1.5 minutes. Let's see. We'll start. Your time starts now. Okay. You ready?
Yes, sir. Ready.
You enter the room and you start.
Hi. Good evening.
Good evening.
Uh, this is Dr. Srikanth, one of the baby doctors today.
Yes,
So,
doctor.
are you mother of Jenny?
Yes, doctor.
So, so I want to take a notes regarding your baby condition
Yes, doctor.
with you.
Sure, doctor.
So, can you tell me what is the problem with your child?
You know, doctor, the GP has given you a letter. She has been having this problem of loose motion, doctor. She's passing a lot of stools in the past 3 weeks, doctor. We have tried everything. The GP has tried treating, but it's not settling down, doctor.
Okay, sorry about that. Uh, I can understand your situation. Can you tell me how did it start? Like suddenly or slowly?
Mm, 3 weeks back, doctor, we went. We had a vacation in the grandma's house that was in the countryside, and we went there. And when we went there, we used to give this milk from here, doctor, from our place. That we used to give formula only, but there we were not able to get adequately this formula, the usual formula tin that she takes. So we bought some milk from the farm, and once she drank that milk, she started getting these problems, doctor.
Okay. I can understand. Is there anything that is worsening, or is there anything making her symptoms better?
Nothing, doctor. Actually, she just passes 4 5 stools, some large number of mucus or some water is coming, and she's passing a lot of flatus. Um, and that's all, doctor. There is nothing. I don't think anything. We tried everything, sir. Doctor, diet, native medicines, all remedies at home that was possible. Doctor also gave 3 4 drugs. Nothing worked, doctor.
Yeah. Okay. Have you noticed any blood in the toilet?
Once she had some amount of small streaks, doctor, but it was not a frank blood, doctor.
Okay, only one time you have observed.
Yes, doctor.
Oh, oh. Can you tell me about how much she's like? Is it a large volume or small volume?
I told you no, doctor. It was large number, doctor. I think it occupies one full diaper.
Okay. Um, did you face any difficulty while flushing the stool?
No, doctor. It was just watery. It went in very well. Was there anything related to that, doctor?
Uh, have you noticed any bursting out of stools after consumption of dairy products?
Oh, what do you mean by that, doctor? I don't understand you.
Uh, any sudden gush of consumption of milk products?
Mm, that's what, doctor. It all started with this milk only, doctor.
Okay. Is there any associated symptoms like tummy pain? Have you felt a tummy pain or any fever?
She used to be very irritable, doctor. She used to be very irritable. I think that was because of the tummy ache. They say doctor said it was colic.
Oh, okay. Uh, any vomiting episodes?
Once in a while, she vomited also, doctor, in the past 3 weeks.
Uh, did she take food properly? Tell me about her appetite.
Her appetite reduced in the past 3 weeks. She used to eat well, doctor. She's not a fussy kid. She became fussy in the past 3 weeks only.
Okay. Can you tell me about her activity? Like, is she active or dull?
She has been active, doctor, at times in the middle, but once in a while, she once her crankiness sets in, she became very dull, doctor.
Okay. Uh, uh, have you noticed any decreasing urine output? How many times you are changing nappies?
Since she is passing frequently nappies, we have been changing, doctor, but she is passing urine well, doctor. There's no complaints with her peeing.
Okay. How many times she is opening her bowels
Five
in
to
a day?
six, 5 to 6 times, doctor.
Uh, okay, I can understand. Uh, is she gaining weight properly?
Yeah, she has been gaining weight, doctor, but I feel the last 3 weeks she would have lost a pound or something like that.
Okay. Did she undergo any surgeries previously?
No, doctor, never.
Uh, any similar complaints in the past?
No, doctor.
Okay.
That's what everybody is puzzled, doctor. She has been well all these years, and now she is doing this.
Okay. I can understand your situation. We'll go to help you. Uh, can you tell me about her birth?
Yeah, she was born. She when she was born, she was a very healthy child. She was born with a normal delivery, and they roomed in a day, and we came home the next day, doctor.
Okay. Did she take all her shots,
Yes,
vaccine shots?
yes, doctor. She took all the vaccination shots.
Um, anybody else in the family is suffering with the same symptoms?
No, doctor.
Yeah. Is there any allergies towards food? Any specific food
For whom, doctor?
uh, of a baby, a child?
No, doctor. I think this is milk only is causing her allergy. What do you think, doctor? This milk probably is causing her allergy.
Okay. It is maybe due to sudden change in the feeding pattern, like what you have said previously. Uh, you got some milk from a countryside, right?
Yes, doctor.
You have given that milk. Maybe that may be the possibility, one of the possibility. So I'm here to rule out the causes.
Yes, doctor.
Don't worry, we will help you out.
Thank you, doctor.
Oh, mm, okay. Yes, you said earlier you went to countryside, right?
Yes, doctor.
Oh, did she attain all milestones properly?
Yeah, doctor. She has been growing and she has been developing well. She is now even walking. She walks. She's she utters a 3 sentence or 2 sentence rhymes also, doctor. Everybody says she is ahead of all.
Oh, that's good. Okay. Mm. How it is impacting your family?
That is very much an issue, doctor. Because of her stools, her dad is not able to sleep well. She has been irritable. He has to go to work. He is also little upset that he is not able to sleep. And I'm taking care of the kid and trying to help everyone in the family. But it's very tough for the family, doctor. He has
So
lost some work days also.
I'm really sorry regarding that. Uh, so have you tried any medication? specific medications?
Only the GP what he gave.
Okay, okay. Is she straining while passing bowl while opening the bowl?
Yes, doctor.
Any difficulty while passing urine?
Any distance?
While passing urine?
No,
Any
doctor. No, doctor.
while passing urine?
No, doctor.
Noticed any rash on her skin?
No, doctor.
Any history of recurrent infections?
No, doctor.
Mm. Mm. Can you tell me about his sleeping pattern?
That's what, doctor. He has been little cranky. So he used to get colics in the night in the past 3-4 weeks, and that is also disturbing everybody, doctor.
Oh, okay, I can understand.
You said rash, doctor. You mean what do you mean by the rash, doctor?
Any skin lesions?
She used to get some patches in the face and then the elbows. That is not like a rash. The doctor said that is could be an eczema.
Okay, okay, okay. Is there any itching?
That also disturbs her sleep, doctor. I think the eczema also disturbs her sleep.
Okay. Oh, have you observed dryness of mouth?
No, doctor. I
Uh,
couldn't appreciate that in a small kid.
has you, has your child undergone any recent tests or investigations for this issue?
No, doctor. 30 seconds more.
Okay. Thank you, Jenny, for your detailed information.
Okay. You have 10 seconds more. Others, you can type your comments in the chat box. You can put your etiology in order and the red flags in the chat box. Can you summarize, doctor? We'll start with the discussion. Can you summarize?
Yes, sir. Yes, sir. I have taken history from the Jenny's mother. She is a pretty girl, 18-month-old child. She's suffering. She has been suffering with diarrhea since 3 weeks. Daily, she is having 5 to 6 episodes on and off. Occasionally, she is having vomitings. She tried all the medications, but she's not improved. She's passing lot of platters while opening the bowl. Mother noticed one time blood streaks in the poop. These are aggravating after taking milk from outside. So her appetite is a little bit decreased. There is a positive history of travel.
Okay.
There is no family history. There is no similar complaints in the past. She's developing properly according to the age. She has taken her jabs. She's having tummy pain also. She's little bit irritable.
Okay. So what do you think will be the cause here?
So I'm thinking that it is maybe due to some allergy like a cow milk protein allergy.
Good.
And she's having eczema over the cheeks also.
Okay.
I think it is maybe due to cow milk protein allergy. Most
Okay.
probably my first preference is that.
Could this be any other reason?
Maybe due to infection.
Okay.
Mm,
How do you say from the history that it is not an infection?
she's not having any fever.
Okay.
Uh, that's it. That's it. I think.
Okay. Anything else you want to add? How are you going to manage this?
So
Child?
I
How
will.
you are going to explain it to the mother?
I will take the vitals first, like blood pressure and pulse rate. I want to check. So I will see abdomen exam. I will do abdominal examination.
Okay.
I will involve my consultant also.
Okay.
I would like to send some investigations, blood investigations,
Okay.
like complete blood picture
Okay.
for iron deficiency or any other nutritional deficiency. I want to look for evidence of infection in that.
Okay.
I will send electrolytes also to see whether is there any electrolyte imbalance or not.
Okay.
So I will send complete urine examination also to rule out any urinary tract infection.
Okay. Suppose you think that this is a cow's milk protein allergy, then how you are going to investigate this child? What is the specific investigation if it is going to be a cow's milk protein allergy?
Radio radiological test, sir. IGS screening.
Okay.
Uh, Skin patch test.
Okay.
And I will look for response to milk withdrawal.
Okay. What is the gold standard test for cow's milk protein allergy?
Skin prick test.
Okay. Okay. What are all the other possible etiologies you think of here?
Other possible.
Could this be immunodeficiency?
Yes.
If it is no, why no? If it is yes, why yes?
Maybe I think no, sir. Because she's growing well, she has not had any previous infections. Her growth is also appropriate.
Could this be a celiac disease?
Yes, sir. There is a possibility because she's having loose stools and rash, and it is a common age of presentation, I think.
Okay. If it is no, then why no?
Her growth is not affected.
Okay. Could this be an infection? GIDSS?
Yes, sir. There is a possibility.
Okay. If it is yes, why yes? If it is no, why no?
Because there is a travel history.
Good.
If it is no, GRDS is usually cause chronic diarrhea, but here in this case, it is acute episode.
Okay. Okay.
Yes.
Okay. We'll stop here.
Okay, sir.
Uh,
I will involve dietitian and
yeah.
gastroenterologist also. I will involve my consultant
Okay.
for the further management.
What all red flags you had in your mind, Srikanth?
Red flags, blood in stools, sir.
Okay.
So she's irritable.
Okay.
Irritability.
So
She's
when you are sitting outside, what all red flags you noted? Can others say what are all the red flags they noted around?
dehydrational signs.
Signs of dehydration.
Yes,
Anybody
sir.
can
Blood in stools.
blood in stools,
Any recent weight loss in these 3 weeks?
failure to thrive. Good. Anything else? Any other rash? Why he asked for rash? Apart from eczema, what else can cause rash and diarrhea?
Celiac disease, sir.
Okay, then immunodeficiencies.
Yes, sir.
Okay. So the alternating constipation and the diarrhea is also an important red flag sign. So that can also cause that can give you a clue. And then somebody has put it in chat HUS. Okay, okay, okay. So that is okay. Then how was the structure? Did you give adequate time? I wanted you, because this is a less than 2 year, I wanted you to give more importance to diet. What all the child was having previously, how the child was being fed previously. So there was some hidden agenda that the child never had cow's milk protein containing substance all these 1.5 years. And then the mother also had some history of eczema. All rest all you asked, you are all asked about the family, social, sleep, illness, coping, all those things. You can ask a little bit about what is your husband doing, how he is, how are you coping with the treatment for this child, all these things you can ask. So this is going to be an acute or acute on chronic or chronic?
I think it is acute, sir.
See, chronic diarrhea means more than?
Sorry, 14 days.
More than 14 days. Okay. But still it's something an acute problem. It is not something like a diabetes or an asthma. So you asked about all the yes or no questions, but some places I feel, you asked, is there any tummy pain or fever? I said there is no tummy pain, and then you didn't ask more about fever. You didn't dwell on the fever. So fever was an important thing. And you had a lot of discussion. I told you that it was a large volume, 5 to 6 times, and you kept asking whether it was large volume again and repeated it at 5 to 6 times. So I gave you more about a clue in the milk. So you didn't explore more about in the milk. Then you didn't do any system screening, and at last you came back with the system screening. So examiner will not like if you go to and fro. So you finish your history, then system screening, and you came down, and then again going back to system screening. Usually they don't like that. Then your empathy was good actually. You could have added a little bit more of empathy. So any investigations you asked at last, then you asked about rash. You can say that most of the UK people they understand what is eczema. So rash is different for them and eczema is different for them. So you can use the word eczema in the exam. So that is also absolutely fine. So these are some of the things that I wanted to say. So what could be the most likely diagnosis here? Is it a cow's milk protein allergy or a cow's milk protein intolerance? And what is the difference between the two? Can anybody say what is the difference between a cow's milk protein allergy and a cow's milk protein intolerance?
Cow milk protein allergy is basically IgE mediated.
Very good.
So
Cow's milk protein allergy is an IgE mediated and intolerance is a
non-IgE
non-IgE
mediated.
mediated. Excellent. So it can, in a same child, you can have both IgE mediated and the non-IgE mediated also. So that is very good. So others, they said that they had infection like giardiasis in the DD. Then they have mentioned that there can be secondary lactose intolerance. But here per se, there is no fever and there is no infection. So it all started with the cow's milk allergy and ingestion of cow's milk. So you can ask more whether they have eliminated the cow's milk and after elimination, what did happen to the child? So that point you could have explored a little bit more. And what is the gold standard test for cow's milk protein allergy?
Elimination and challenge test.
The elimination and challenge test. Excellent. So you have to eliminate and then you have to challenge. So these points you can add. And your diet history should be more important to rule out certain conditions. What is the most important condition we will rule out with the diet history? Previous diet history. Others, you can also answer. Anybody can answer. Somebody has mentioned that in the chat box.
Celiac.
Diet history, more of functional diarrhea. So functional diarrhea is associated with the giving more some specific diets where you get more of functional diarrhea. So you can ask about the functional diarrhea with the diet history. So what is going to be the treatment here?
Eliminate. Avoid cow milk, and we will advise hydrolyzed formula or elemental amino acid formulas.
Okay. You have eliminated still the child who is breastfed has such symptoms.
Then I will ask mother to don't take any dairy products.
Very good. So mother also should avoid dairy products. Okay. So all this, some book says you can do stool alpha-1 antitrypsin, then eosinophilic cation proteins, IgE, cow's milk specific IgEs you can test. But the gold standard is giving cow's milk and trying that. So overall, you did very well. That's the outside points. Some of them have mentioned in the chat. And structure, you couldn't give little bit more time to the diet history. I would have preferred you, given what the child was taking previously. So was there any previous such episodes? You could have given little bit more on diet history. Anything else he missed? Anybody you can add? And then you followed this plan. That is absolutely fine. And in your discussion, you can be little bit. You don't put a lengthy sentences in summarization. So I think you can summarize a bit short and sweet. You put all the positive points in the summarization and tell your possible diagnosis. Give 1 or 2 possible differential diagnosis. And if the examiner wants more, you can add 2 or 3 other differential diagnoses.
Okay, sir.
Anybody else wants to add anything else? Any other doubts in the structure for history taking? Or any other sessions you want? We will arrange for other sessions in future.
So just a doubt.
Yeah.
We were talking just now we were talking about dietary history and
Yeah.
functional diarrhea. I didn't get that point. Like what specific dietary history?
Yeah,
and functional diarrhea?
some mothers they give specific some of the fruit juices. Some fruit juices cause constipation because they don't have pulp in that. Some
Okay.
fruit can cause functional diarrhea. They will stick on to some diets where you can have diarrhea, and some children can have can pass stools 5 to 6 times a day. almost always every day. So that's not associated with any illness. So that's sometimes physiological also. So where there is no any pathological manifestation, that the child has no irritability, no vomiting, there is no blood in the stools, no failure to thrive, then you can call that as functional diarrhea. Any other questions?
Sir, is there any terms like persistent diarrhea or anything like that?
Yeah, there are some terms like persistent diarrhea. Means if the diarrhea starts with the infectious etiology and then it goes beyond 2 weeks, then it is called a persistent diarrhea.
Okay, so in our case, is it a persistent or is it a chronic diarrhea?
It is most likely to be a chronic diarrhea because there was no fever. There is no history suggestive of any infection.
Okay. Thank you.
That countryside is it's a googly, that's all. So to make you little confused for giardiasis. That's what you could have little bit more explored on that part. Whether after stopping milk it helped or not, whether they tried stopping milk or not. Okay. Anything else you want in future? We can arrange. Sir, can you repeat gold standard test for CMPA? You should eliminate cow's milk for some days and then you challenge. If the child already had some anaphylaxis, such kind of reactions, this child, you didn't explore a little bit more on that part, whether this child had V's or whether this child had a worsening of eczema during cow's milk or anaphylaxis like features. So you didn't explore on that part. But sometimes when they had anaphylaxis, then you have to admit them in the hospital and then you can challenge. And you have certain ways to challenge. You give in a low dose, you give 0.1 ml of milk, then after half an hour you give 0.5 ml, then 1 ml, and then you can challenge like that. Any other doubts? Anybody has any doubts in the structure? So I want you to be very thorough with this structure. So see in the when you're waiting outside, you have 4 minutes time. Write down the etiology and the red flags. Then you give a lot time based on these columns, and you make sure whether it is an acute on chronic or a chronic. Here it is a chronic diarrhea, but started just 20 days back. So it is not something like an asthma or it's not a diabetes. So he asked more yes or no question, then that is acceptable. So you can bring associated points like eczema, asthma here, whether the child was wheezing a lot. So all these points. And since this is a less than 2-year-old child, you should have asked more on the previous diet history. So rest all is fine. His management planning, his rapport and communication style was good. There was no interruptions to the role player.
Okay.
Any other doubt? Yes.
Sir, what are all questions should I ask in system review, sir?
You just go through fast the CVS, CNS. The mother said irritability. So did he have any seizures? Did he have any fast heartbeat? Or did he have any cough and cold? Did he have any? Did any of the doctors said he has wheezing in the past? Then you can ask about you did ask about rash, and then you did ask about the joints. Then you should ask about whether he had any hearing issues or vision issues like that. So then you should ask about is other just you finished with the MSK. So any other gland doctor you have seen for any gland problems? So that also is important here. So these things you just run these history touch upon each system fast.
So is it relevant, sir, to take all these systems in this case?
Yeah, see, just the system screening is very important. They will give marks for system screening. They will have some hidden agendas. Sometimes in the constipation, it may not be a functional constipation. So they can have some gland doctor. Yeah, I have seen a gland doctor. He said there was some gland issue here. So they will bring those things there.
Okay, okay, sir.
Somebody
Thank
has
you.
asked, can we have the record today, please? Thank you. Sure, we'll give you the recording. Sir, in case of chronic conditions, can we ask the past history early? Yeah, you can ask the past history early. So you pull all the history together. So presenting history, systemic screening, complications, treatment history, you pull everything together. Okay. If you have a significant past history, I think you can bring all this here. Past history means what is the treatment, what is the complications he has faced in the past, all these things you can bring it here. But don't go back and forth. When you come to family, social, don't ask about system screening. Just group the histories together. Because they give marks for your schematic. So in this domain, clinical domain, if you see how they are going to give marks, information gathering and history taking, is it a structured approach? They'll use this word structured approach. So when you go back and forth, then they will not give marks. I think we'll end the session today. I think you had some benefit from this today. We'll definitely share the recordings tomorrow. You can put your feedbacks in the group, in the large group. Thank you all for joining. We'll have some more free sessions coming up every week once, most probably. And if you want anything specific, you can put it in the group so that we'll arrange for that class. I think everybody in the large group, we want to benefit. We want you to get benefited of. And if you have any recent exams, anything specific you want to understand, you can discuss in the group. We are all open, and we'll have a good, proper discussion in the group. Thank you. Thank you. We'll end this meeting today. Thank you.
Thank you, sir. Thank you, sir.
Thank you, sir.
Bye.
I